So now we have part 3, in which we are going to discuss how NDT helps our clients to solve problems with specific symptoms and situations, for example. And in this case, I'm going to ask you if you can provide practical cases, or if there are many cases and they are quite common, overview of your clients who solved these particular issues with NDT. And we can start maybe with addictions, for example, to, let's say, alcohol and drugs. So how it relationship and how it helps.
All right. Well, in terms of focusing specifically on the new decision therapy, that can help with a person who's, first of all, if it's going to help with an addiction, the person who has the addiction needs to want the help. Mm-hmm. Because new decision therapy is a process that's done from a state of willingness. Okay? So that is the starting point. And for those who have come to see me, who have that willingness, who want to get on the other side of their addictions, we've had great success. The other thing that I'd want to qualify here is that it usually requires more than just the new decision therapy to create really satisfactory and long-lasting changes. So there is a follow-up technique that we use in new decision therapy that helps to dismantle the years of habitual behaviors that have been set in place as a result of old coping defaults. And usually those old coping defaults, where somebody's trying to push down severe amounts of emotional pain and so on, the addiction becomes a way of coping or self-medicating. So when you're able to clear those raw, unprocessed emotions out of the system, there isn't such a driving force to keep the addiction alive anymore. However, you do need to debunk all those habits that have been patterned into the system. And that's what we do in our second phase that comes after new decision therapy, called kantillation, with a K. K-A-N-T-I-A-L-L-A-T-I-O-N, kantillation. And Candace based that work on the work of somebody named Dr. John Diamond, drawing on a lot of his wise and wonderful work. And then she modeled it into something that was well matched with the new decision therapy process.
Mm-hmm. And in relation to specifically, like, let's say, alcohol and drug addictions, what you can say, because it would be kind of more general overview that you presented right now. And so it helps people to deal with alcohol and drug addictions. So
first of all, dismantling the underlying trauma that is driving the addiction in the first place, and also dismantling the old patterns of habit that are also driving the person towards the addiction. Can make a world of difference, and not just for drug and alcohol addictions, but also for, say, an addiction to sex, out of the normal range of what somebody would need or want, where the sex is just taking over, or pornography. Yes.
The pornography addiction can be often linked back to a trauma, which.
Yes, and then if a person is finding that that addiction is still continuing even after they've cleared of the traumas, that's when we go into the kantillation process, and it's the kantillation where I find I get the biggest success in terms of dismantling the addiction permanently. But we do not even enter into a kantillation process without having taken someone through new decision therapy first. That's number one.
Yeah, kantillation looks like, remember from training, that it's more kind of about projecting a person into future, like making him or her.
Whereas new decision therapy is dealing with past. Cantillation is dealing with how you're relating to what's coming next, fears and anxieties about future and what's ahead, and it's tapping into a whole other set of meridian points other than the ones that we've used with new decision therapy that are connected to the qualities of life.
And food addictions probably, maybe to sugar.
Food addiction, and then that kind of moves into eating disorders. So new decision therapy followed by cantillation is also extremely beneficial for that sort of thing. I've worked with a number of clients who'd gone through major years of various clinics to get past the eating disorder, and then this is what finally got them through that tunnel
The
and
trauma
out the
was
other side.
the
Yeah.
trauma was the starting point. When people
And once they were able to get past all of that and get out of that state of stuckness, then they were able to get out of the constant eating addiction cycle. And that could be like overeating, it could be anorexia, it could be, bulimia, all those different playouts of eating disorders.